commissioners look as good as our staff does for us. In terms, as you'll see here, when we speak about Guatemala, the deep dives into the research that they do, and also into their ability to put pen to paper in a very sophisticated and fluent way. These are remarkable people. Many of them are young people, recent law school graduates, people headed into politics, academia, law. It's really a great group. It
we have,
restores
I think,
your
almost
faith
24
in
people
government.
on the staff right now. So we have the executive director, who I mentioned, Valerie Bonham, and she is the executive director overseeing the staff.
So,
There too.
there we are. So this all began in 2009 when a Wellesley professor named Susan Reverby was doing some research in the archives at the University of Pittsburgh. And she was actually researching the Tuskegee study, in which, as you may know, a group of Southerners, African Americans, were followed to try to understand the natural history of syphilis. And they continued to be followed without treatment after effective therapy for syphilis was available, but was not made available to these individuals. So Susan was studying this issue and came upon a public health service funded study in Guatemala a long, long time ago, in the late 1940s, before almost all of us were born. She alerted the Centers for Disease Control, HHS, as well. They did an independent investigation and then presented a report which HHS released to the public a little over a year ago, last October. And this was a somewhat damning report, as you'll see, about what happened in a study led by U.S. citizens, funded by the federal government and the predecessor of the NIH, the largest study of its type that was funded, encompassing close to 2% of the NIH budget between 1946 and 1948. And you'll see that the details are pretty brazen, but there are also some subtleties here that make this really an interesting problem. On October 1st of last year, there was a formal apology made by Hillary Clinton and Kathleen Sebelius in a joint statement. And they reported in this apology that the study was clearly unethical, and they extended this apology to all individuals who were affected by these abhorrent research practices, they called it. Our president, President Obama, then followed this with a formal apology to the president of Guatemala and asked that finally our commission oversee a fact-finding investigation, but in addition, look into the current rules for clinical research to see if this could happen again or if something like this could happen again. And then third, asked us also to bring together, to convene an international panel to look into these events and to help us understand their views about the current climate of clinical research. So, in brief, this involved the intentional inoculation of a variety of individuals, often without their consent, with syphilis, gonorrhea, and chancroids, sexually transmitted diseases. And you'll see the gruesome details to follow. But before that, it might be worth, if this is interesting to you, perhaps a little more on the medical side, to tell you a little bit about the landscape of society and science with respect to these disorders before we go into the details of what happened in the late 40s. Would that be something you'd like to do? I think it would be worthwhile. So sexually transmittable diseases were a huge problem in the military and also in civilian populations. A couple of 100,000 cases, major causes of troop unreadiness, huge problem in World War II and before. With the Cold War heating up, great fear that we were headed to another war, which of course became Korea or something worse. And it was thought that an effort to improve troop readiness by reducing the burden of sexually transmissible diseases was about the highest priority for the government. So what was going on then? Well, even in civilian populations, we think that about 20% of people in mental institutions were there because of tertiary syphilis. At the same time, there were remarkable advances. First, the sulfa drugs, sulfanilamide, in 1938, an effective treatment post-exposure for gonorrhea. And then penicillin in 1943, effective post-exposure therapy for syphilis, the worst of the sexually transmitted diseases in the pre-HIV era. However, the effectiveness of these drugs in pre-exposure prophylaxis was entirely unknown. These drugs had replaced other, usually heavy metal compounds. You've heard of arsenic and the like that had been in use since the beginning of the 20th century. And again, the effectiveness of those drugs was unclear. The general policy in the military was to advise that soldiers wash topically their genitals with a compound solution in order to protect them post-exposure, immediately post-exposure against gonorrhea and syphilis. But we really didn't know how well these worked. So either it was just a solution or a solution followed by actually a silver injection into the penis of these men that was the standard of therapy at the time. So this was a big issue on everyone's plate. The initial precursor of Guatemala was in the Terre Haute prison system in 1943, where a study was begun to try to understand the value of these topical ointments and of the new sulfanilamide following exposure to gonorrhea. And a decision was made in this prison study to intentionally infect prisoners with gonorrhea by inoculation for these studies. These were failures because the inoculation rates were very low, about 5% or lower. So you couldn't do a useful controlled study, and the study was abandoned. All right, so that is the...
One important caveat about that study was the researchers that Steve is about to talk about were involved in that first study. And in that study, they obtained informed consent from the individuals who were participating in that study. So they were advised as to what the nature of the study was, what their participation in the study was, what the risks of the study were, and there was significant conversation about the need for informed consent from the patients of that study. And that's an important precursor to this study by contrast, given that it was the same researchers building on the Terre Haute studies.
This is the critical point, that this was a study done by informed consent and was voluntary. Now, people at the time and in retrospect, one can question how voluntary this really was. It was deemed acceptable to pay the prisoners for their participation. No promises about leniency were made. Strong arguments that this would be a patriotic thing to do were made, and that could affect perhaps leniency down the road. So the degree to which there was truly freedom of choice to say yes or no, I think, is still debatable. But this study clearly established the principle of mandatory informed consent of some type before an invasive experiment of this type. And that was 1943, so 3 years before this began. And as Nita states correctly, some of the individuals, and particularly John Cutler, who was a very young investigator at that time, and even in Guatemala was a figure in the Terre Haute studies. So, when the Clinton and Sebelius apology came, this made big news, and it was hard to escape reading about this in the newspapers. And this is the note from the president asking us to carry out these 3 charges. What happened? Could it happen again? Let's get international buy-in on these opinions. So we broke up the president's charge into 2 different studies. The first is an understanding of what happened, and it is here where